Hi, my name is Alison Cabrera. I'm going to talk about Ribavirin for chronic hepatitis E virus infection in transplant recipients. Definition: hepatitis B is a serious liver infection caused by the hepatitis B virus HBV. For some people, hepatitis B infection becomes chronic, meaning it lasts more than 6 months. Having chronic hepatitis B increases your risk of developing liver failure, liver cancer, or cirrhosis, a condition that permanently scars off the liver.
Hepatitis E is RNA virus, spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged uremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use.
Applications in medicine. The median time between the diagnosis of HIV infection and the initiation of ribavirin therapy was, at the time that ribavirin therapy was initiated, 34 patients had persistently positive tests for serum HIV RNA for at least 6 months. 20 patients had had viremia for 3 to less than 6 months, and 5 patients had been infected for less than 3 months. Pros and cons. To date, there is no established therapy for HEV infection. A reduction in immunosuppressive therapy, mainly immunosuppressants that targets T cells, has resulted in HEV clearance in nearly 30% of solid organ transplant recipients with chronic hepatitis. 6 to 10 small case series and case reports in this population have shown that a short course of pegylated interferon or ribavirin as monotherapy can effectively treat HIV infection.
Hepatitis E virus, referred to as HEV, is a common cause of sporadic and epidemic acute liver disease in developing countries. In the United States, sporadic cases of both imported and locally acquired HEV infections are mostly seen among adults. Incubation ranges from 15 to 60 days following exposure, with an average of 40 days.
Issue applied in Ecuador. Vaccinate a newborn in the first 24 hours is essential to prevent mother-to-child transmission of hepatitis B. In Ecuador, for example, hepatitis B is a notifiable disease, and the most important preventive intervention is universal vaccination, which can prevent infections in 95% of cases. To continue making progress towards eliminating the disease, the Ministry of Health has intensified vaccination campaigns and diagnostic tests in the population. The national plan aims to eliminate mother-to-child transmission of hepatitis B in the next 5 years. Conclusion. In conclusion, the retrospective multicenter case reviews show that Ribavirin as monotherapy can be effective in treating chronic HIV infection. A 3-month course seems to be appropriate duration for this therapy, though a longer therapy can be given to heavily immunosuppressed patients and those who still have viremia 1 month after the initiation of therapy. However, retrospective studies are required to determine the most beneficial dose and duration of ribavirin therapy.
At the same time as HBV, called co-infection, or infect someone who has chronic HBV infection, called superinfection. If detected, it is usually in the context of a hepatitis B outbreak, or perhaps when a patient with acute hepatitis B has a more severe clinical course than expected. HDV and HBV co-infection occurs when a person becomes infected with both viruses at the same time.
Immunotherapy in renal cell carcinoma. Definition: renal cell carcinoma is the third type of urologic cancer and has a poor prognosis with 30% of metastatic patients at diagnosis. The antiangiogenics and targeted immunotherapies led to treatment remodeling, emphasizing the role of the tumor in microenvironment. However, long-term responses are rare with a high rate of resistance. New strategies are emerging to improve the efficacy, and the emerging drugs are under evaluation in ongoing trials, with the different treatment options. There is an urgent need to identify biomarkers in order to predict the efficacy of drugs and to better stratify patients.
I think it's a truly exciting time. I mean, bladder cancer has been pretty much neglected for decades. We had cytotoxic therapy that had some modest efficacy, I would say, in patients, and now we're witnessing a true revolution with the approval of 5 immunotherapies. We're still, I think, working our way through in how to best identify patients who may benefit from these therapies and how to improve these therapies. But I think we are witnessing very durable responses in a subset of patients. Patients can benefit from these therapies for years with really sometimes minimal side effects.
Applications in medicine. Immunotherapy with monoclonal antibodies directed against programs of TET1 protein PD-1 and cytotoxic T lymphocyte antigen 4 CTLA4 has become an integral part of the management of R.C.C. The fields of immunology and oncology have been linked since the last 19th century, when the surgeon William Coley reported that injection of killed bacteria into site of sarcoma could lead to tumor shrinkage. Since that time, exponential advances in the understanding of the intersection between immune surveillance and tumor growth and development have led to broad therapeutic advances that are now being studied in all cancer types.
The most interesting data and the one that people are very excited about is the emotion 151 that we just heard from Dr. Bob Boozer. And this is a phase 3 randomized trial that looks at bevacizumab with atezolizumab versus sunitinib in a phase 3 setting for advanced metastatic clear cell kidney cancer. So let me just give you a little background on how we treat kidney cancer.
Pros and cons. For patients with treatment-favorable risk disease who are asymptomatic or minimally symptomatic with limited disease burden, we suggest close active surveillance to determine the pace of disease. Surveillance allows the deferral of therapy and its associated toxicity until more compelling disease progression is documented.
So the things are clearly evolving for several years now, but especially since last year, when we had the results of the Immunotherapy versus everolimus randomized phase 2 study, which demonstrated that in patients who fail one or two VEGF-targeted therapy, there is a role for IO immuno-oncology and namely nivolumab.
Issue applied in Ecuador. The choice of treatment for patients with advanced disease has been based on prognosis risk factors historically developed in the era of frontline vascular endothelial growth factor receptor VEGFR tyrosine kinase inhibitors. The International Metastatic Renal Cell Carcinoma Database Consortium prognostic model integrates adverse factors.
Checkpoint inhibition, that is actually a form of immunotherapy. So that whole class of therapy, what it essentially does is ramps up your own immune system and releases the brakes that the tumor created to slow down your immune system from fighting your own cancer. Let's go the brakes so that you can fight the cancer yourself.
Conclusion. For most patients with advanced clear renal cell carcinoma, systemic therapy is typically initiated promptly when unresectable disease, either metastatic or locally advanced, is present. The decision to start systemic therapy and the selection of agents depend on disease-related symptoms, patients' comorbidities, and tumor risk stratification.
Focused on the first line, and clearly it's the future. It's already the standard treatment with double IO, IO TKI. But the main points, we have two challenges. First, we have to know how to select the good combination for the good treatment, for the good patient. And we have IO or IO TKI, and we don't really know. We need biomarkers to identify patients who will derive any benefit from this combination. And in order to identify this kind of biomarker,
Thank you.